number one, teacher as inspiration and best doctor. So how do you feel about it?
Getting recognition as a teacher and as a doctor from the students is a really great thing, and I feel that I am justified in whatever I have done for last 34 years. Last 34 years I have been the teacher and the doctor also, and more than a doctor I have been a pediatrician, and that brings in more credibility to the profession. And it's always a great thing. I have strived for that. I have done sincerely for the welfare of the students and for the welfare of the patients. And if the students have recognized that, it's a justification for all my deeds which I have done for the last 34 years.
Any memorable incident you would like to share with us?
Memorable incidents, there are so many during the day-to-day practice. You come across so many types of patients, so many types of their relations, their patients, so many problems. You try to tackle them, and every patient teaches you something new. One thing has to be kept in mind by the people, that no two patients are same. No two patients are same. Every patient has got a different biology, a different history, different symptomatology, different manifestations. And one thing to be kept in mind also, my teacher used to say that the books are written by looking at the patients. Patients don't behave as per the textbooks. So you can't make a decision saying that this is not in the textbook, so that this can't be like this. So every patient is a different one. And beyond that thing, beyond the all sophisticated gadgets, treatments, modalities, there is something else is there in the patient which decides the ultimate outcome of the patient. I've seen many times that scientifically we do so many things. We take the help of all the investigations, we do all the things, but the outcome becomes different. Sometimes we see the patients will improve, but he gets into so many complications and lands up in so many problems. Other way, patient comes in a very moribund condition, we tell the patient is not going to survive, but he exceptionally does well. I'll give you one or two examples. There was one baby was there who came for, I was Sikeli's city polyclinic. We were doing consulting. He came in the evening at about 6 o'clock, 6:30 or so. They came for a triple antigen injection. They had brought the injection, and I was supposed to give the injection. Just a simple triple antigen, which we give day in and day out to so many patients. Thousands of patients are being given every day. Even the remote of the villages, the JNMC gives injection. Nothing happens. That child from a well-to-do family, the mother is a bank employee, father is some agent, LIC agent. They got a healthy baby, about 4 months old baby. And as usual, we took the injection and we gave the injection. As soon as we gave the injection, the baby went into cardiac arrest. Heartbeat stopped. The baby became pale. Nothing is there. Everything absolutely, we don't have any other facility. The baby is almost dead in front of me. How should I answer? Patient has both educated patient, a healthy baby has been brought to the injection, they were going to cardiac arrest. So the parents of mine, what I did is I started doing the cardiac massage. I told the person to keep the van ready and we'll go to the hospital because we can't declare the death a death. So the grandmother also was there, so we took the baby. I was just pumping, doing that. There were no heartbeats coming up, there were no movements. I sat in the vehicle, it was an ambassador car. I sat there, grandmother was sitting. We formed that this thing in that heavy traffic. 7 o'clock, we somehow maneuvered and came. And by the time till I was entering the main gate of the Kelia hospital, no activity of the life was there. The grandmother was continuously chanting something like Vitova, Vitova, Grandpa, Vitova, Grandpa. And with that rhythm only I was just pumping it. And by the time I entered with the baby in my hand, I entered the casualty, baby took the first gasp. And then we started oxygen, we started the drip, we gave them again, then we took it oxygen. And within 1 hour, within another 15-20 minutes, the baby was revived. and that child is now almost about 15-20 years old, 15-16 years old. They bring every birthday, they bring the child and show to me, say, sir, this because of this baby has survived. See, these things have happened. You can't predict what will happen in a given case. That's what I said. A child, a patient, every patient is a different patient. He can't be on the same way. The innumerable examples I can give. Wherein every patient behaves in a very different way, and one has to be alert. And that's why my teacher used to say that every patient is going to teach you something new. You have to learn from it, and you can't take every patient for granted. That is the case of gastroenteritis. It happens so many times. A simple case of gastroenteritis we have admitted, and it has turned out to be a case of encephalitis. It's gone to so many complications, and it leads to so many complications, so many morbidities. So these are the things which teaches you in your life apart from the textbook. So these are the experiences one has to learn.
So how do you feel being nominated as Students' Choice #1 Teacher in final year, Students' Choice #1 Teacher for most entertaining classes, and Students' Choice #1 Teacher as a best doctor?
I think it is really, I feel very good, because when we get award for anything, but when all of you choose and give us, it is going to be a great thing. And I have been inspired by our teacher, like Dr. Desai, who used to take very good classes, very entertaining classes, and then he was a very good doctor. With that his own model, I inspired by him, and then same thing I continue to be. And I'm very happy that you all appreciate, and we should continue the same thing, and few more people should do such a way that you all enjoy. You enjoy the class, that is our goal. You learn is our goal, because books are there to read, but ultimately books will not give you many things. So what I found as a difficulty in my undergraduate days, that I have been highlighting in my classes, so that you get better understanding and you get a concrete idea of the disease. So we remember still our classes as a clinics or classes still now when I was a student, and same thing I should incorporate into your understanding. That is why my goal, and that ultimates into this sort of a thing that you appreciate. I am very happy about all the things, and I really feel good about that.
So will you please share a funny or a memorable incident in the clinics or classes, theory classes?
No, few people give proxies, and few people sleep, few people yawn, and we appreciate them, and few people not bothered about anything, and they are the one really do well in the life, and I appreciate them, and I feel I enjoy some time with those people. Otherwise, most of the people look very comfortable, and they are very studious within our classes.
So we would like you to share your experience as a teacher in JNMC.
No, that it is great, that the phenomenal great, that I enjoy. I feel appreciated and enjoy my morning classes. I take clinics, I feel good. And that is what, that I have a practice. I can practice and earn better, but this is it is my joy that makes me very comfortable. That is why it is good that as a teacher, and so many students call us, so many students are in abroad, so many students are in very higher post, and they invite us for all the things, and it is what is the achievement from us, that it works for us, that, and it is a great thing that all you do well, and you respect, and you become better, is our we become better. That is the whole thing.
So lastly, any message to your students?
Yeah.
Any message to your students?
Don't feel any problem with the classes. Enjoy classes. That is the whole thing. Attend classes is the first thing, and then enjoy classes is the second thing. Ultimately, knowledge will be gained, and you will be very good doctors.